Welcome to the Joint Connection class. My name is Kim Barnhart, and I am a social worker in the case management department, and I help with discharge planning. So we're going to talk about preparing for your return home after your surgery is complete. And one of the things that I just want to let you know is that effective January 1st, 2020, total knee replacement surgery has become an outpatient procedure now. For total hips, there's a chance that it would be an inpatient depending upon who your payer is. Some insurances require it to be an outpatient procedure as well. And I'll talk in a minute about the significance of that. But most people are able to go home after they've had their hip or knee replacement surgery with the assistance of various people. Most of the time, people will go home with the help of either family members or friends and often receive outpatient physical therapy. So that's going somewhere to get your therapy after you discharge from the hospital. And some of the things to keep in mind are how easy is it for you to get in and out of your home? Are there many steps that you need to go up to get into your house? Do you have railings? Those will be some things that will be important to know or be aware of so that our therapists can practice with you while you're here in the hospital to make sure you'll be able to get up those steps to get into your home after you leave the hospital. And then getting in and out of the car, if that's a struggle for you right now, chances are it's going to be a struggle for you after your surgery. Again, that's something that our therapists can work on with you while you're here in the hospital. We do have a car in our therapy gym that they can practice with you. So sometimes people will go home with the help of family and friends and need to have home care come into their house because it's too difficult for them to get out of the house and go somewhere for therapy. So Medicare and most health insurances will pay for a person to have home care services, but you do need to be homebound. And the definition of homebound is that it takes extreme effort to get out of the house. So it requires someone to take you where you need to go, and you're not leaving the home to do other social things like go out to dinner or meet up with friends. If you're able to do those kinds of things, they figure you can just as well go somewhere to get your therapy. So home care is a temporary service. They will do it as long as you meet that homebound criteria and you're continuing to make improvement. But once you're no longer homebound, then they would expect to stop the home care therapy, and you could, if you still needed therapy at that point, start going outpatient to outpatient therapy. And as I mentioned, it's payable by Medicare and most health insurance plans. The last option that might be considered is going to a TCU or a transitional care facility, which is a level of care between a hospital and going home. It does need to be medically indicated in order for it to be covered by insurance. Sometimes, because, as I mentioned earlier, the total knees are outpatient procedures and some hips are outpatient procedures, Medicare does have some strict guidelines about when they will pay for a transitional care facility. Now that we've got this COVID pandemic going on, a lot of Medicare and health insurances have waived some of their requirements. So it may be a little easier to get into transitional care right now, but once this pandemic passes, they're going to go back to their previous rules, which in Medicare's verbiage is you have to have a 3-day inpatient hospital stay before they will pay for a transitional care facility. And we can't give you that 3-day inpatient stay unless it's medically necessary for you to be here. If it's simply to meet that requirement of a 3-day inpatient stay, they consider that Medicare fraud, and we're not allowed to do that. Most of the time, you have many options for TCUs. Right now, in our COVID world, those options are getting smaller and smaller because of various reasons. But our case management department of social workers will help you get into a transitional care facility if that's necessary for you. And as I mentioned a little bit earlier, the different payers, there's Medicare with a supplemental insurance. Typically, that's people 65 and older. And as I said, they do usually require that 3-day inpatient stay. Right now with COVID, they are not. Some folks have Medicare Advantage plans, and depending upon your plan, would determine whether or not you have any out-of-pocket costs to go to a TCU, so you would need to call your health plan to ask about that. The same with commercial health insurances. Depending upon your health plan, might have some out-of-pocket costs related to going to a transitional care facilities. And some of the questions that you may want to ask if you call your health plan are, do I have a benefit for a skilled nursing facility? Most of them will probably say yes. And then ask specifically, is there a requirement for a specific number of inpatient hospital days before it will be covered? That's an important question to ask, to know if it will be covered or not. And then ask if there are specific facilities that are considered to be in-network providers, because if they're not in network with your health plan, you may have higher out-of-pocket costs because of that. So in preparing for your success at home, think about who your support system is going to be. We strongly encourage you to have someone stay with you the first night or two after you get home from surgery. That person can help you with your exercises, help get your pain medication, get ice packs for you, help you with meals, and just do some of the little things that you may not feel up to doing that first night or two after you get home from surgery. If you're going to be spending the majority of your time in recovery alone, you might want to consider planning meals ahead of time, even doing some bigger grocery shopping so that you've got food and supplies on hand, or planning who will get your groceries for you while you're recuperating, and do the small household tasks that you might need done while you're recovering. Physical therapy is going to talk to you a little bit more about what equipment you might need after your surgery. But if you can, if you may need a walker or a cane and you don't care to purchase one or have them on hand, you might want to talk to friends or neighbors to see if you could borrow some of that equipment, or if you know someone who's had the surgery that you're about to have. Preparing your home environment, you were each given a book about, how to prepare your environment for your return home. So it's either page 8 or page 9 in your handouts if you want to read over some of those instructions that are in there that will help prepare your home and get things ready for your surgery. And then having a plan for how you're going to get home. Is it a family member, a neighbor, who will bring you home when you're ready for discharge? So those are all good things to think about ahead of time. There's a lot of resources in your books. So in that preparing for discharge home, you'll find the phone number to our case management department. If you have specific questions or concerns about your recovery, please feel free to give us a call before you come in for surgery, and we'd be happy to talk over any specific concerns or questions that you might have about preparing for your surgery. If you think you might need a temporary disability parking permit during your recovery, you can find those online. I just Googled the Minnesota disability parking permit or the Wisconsin disability parking permit, and it was one of the first 3 choices that you could pick from when you Google that. Or if you don't have access to the internet, you could also call the Department of Motor Vehicles, and I'm sure they could send you out an application. But those applications, if you print that off, you need to take it to your primary care physician and ask that person to fill it out and sign it and give it back to you. And then you just bring that application with you to the license center, Department of Motor Vehicles, to get your temporary parking permit, disability parking permit. And if you would have loved ones that are coming to town, that maybe isn't going to be so much the case right now with COVID because we're limiting visitors in the hospital. But if you have loved ones that would need to stay at a hotel, you can also reach out to us and we can get you connected with local hotels that are able to assist you. So again, I'm Kim in case management. You can talk to me or any of my colleagues in our department. The phone number is in your books somewhere around pages 8, 9, and 10. The 2 books are a little bit different depending on if you're having hip replacement or knee replacement surgery. But feel free to give us a call if you have any questions. Thank you.
Hello, everybody. My name is Chris. I'm one of the inpatient pharmacists here at Lakeview Hospital. My job here today will be to go over what you can expect before, during, and after your surgery from a pharmacy or medication standpoint. So in your packet, you should have gotten a blank medication list. This is going to be one of the main things or your homework, what you'll have to do before your surgery for the pharmacy. So on the medication list, we want you to be as complete as possible. List all prescription medications you're taking, over the counters, and any supplements or herbal supplements. We wanted to know the full drug name, strength, like how many milligrams, how many times a day you take those medications, how many tablets or how many times a day. You take two blood pressure pills twice a day. We want to know that. And also if you know the reason why you're taking the medications. And this includes all like supplements, any, baby aspirin, fish oil, because some of these medications, even though they're not prescription, can cause complications before or during your surgery. So we want to know if you're taking those and if they need to be held or not. We also want to know about any drug allergies you might have, and specifically what that drug allergy is. For example, is some people when they take morphine or codeine get an upset stomach and they consider that a drug allergy. Well, we consider that more of a side effect, and we wouldn't consider that a drug allergy, so we would still probably give you the codeine or the morphine. Day of surgery, you will have in that list, and before your surgery starts, you'll be in one of the pre-op rooms, and you will either meet with myself, one of my colleagues, or one of our interns. Talk about your medications. It might be done in person or over the phone if coronavirus is still an issue going on. So what we're going to do is we're going to find out what medications you're taking, when you last took them, and why you're taking them. So you might have somebody talk to you, a nurse talk to you before you get there, and you'll have somebody from pharmacy will talk to you during the day of your surgery as well. And we just kind of take that medication list and let the surgeon know what you're taking so they can resume your whole medications or wait until you go home to take them. So a little bit of the medications you're going to be taking while you're in the hospital. You'll be getting some medications pre-op or before your surgery starts. A few of those will be, and this isn't an exact list, but this is one of the more common ones what people will be taking depending on what you're having done. Most people will get Celebrex, which is this type of anti-inflammatory. I tell people to think of it as like a fancy ibuprofen. Gabapentin, which is used for nerve pain. Some sort of antibiotic. Anytime you have surgery, anytime you're getting cut open, there's always risk for infection. So we do that. We try to minimize that by giving you antibiotics for 24 hours. And Oxycontin, which is a long-acting pain medication. You might be thinking, well, why are you giving me all these pain medications if I haven't had any surgery yet? All these medications, they're long-acting, so we like to get a jump on the pain. Most of those medications will last for 12 hours. As soon as you come out of your surgery, you'll already have some of the pain medications working and thus need less throughout your hospital stay. Some medications given after your surgery during your hospital stay. We will give you scheduled Tylenol, unless you have a contraindication to that. Gabapentin for approximately 3 days to help with any nerve pain. And Ketorolac or Celebrex, which are anti-inflammatory medications. And you'll get antibiotics for 24 hours as well. We found that the scheduled Tylenol works very well for people in helping minimize the amount of narcotic pain medications you need. You get discharged from the hospital, most people will get a small amount of narcotic pain medications, such as oxycodone, Percocet, Tramadol, Norco, or Vicodin, and hydromorphone. Most people will get prescribed oxycodone, Percocet, or Norco. You'll probably only get 10 tablets at a time, enough to last you for 3 days. Given the other pain medications you'll be taking and with physical therapy, that is all the longer you should be needing to take the narcotic pain medications. If you need to take anything longer than that, you should probably have to talk to your doctor. One of the biggest side effects of narcotic pain medications is constipation. When you're in the hospital, we'll start you also on stool softener and laxative. Obviously, we'll continue that until you are done with the pain medication. Available also over the counter if you don't have any at home. Anticoagulants, fancy term for blood thinners. One of the biggest risks of having surgery is developing clots. Depending on what you have done and what your condition, your health, your overall health is, you will get put on some sort of anticoagulant or blood thinner. This can usually last maybe 10 days, or you may be on it for up to a month, depending on what you had done. The more common ones will be warfarin, Lovenox, which is a shot that you give yourself in your belly, aspirin, or Xarelto. Lovenox and Xarelto are very expensive, so make sure you bring in your pharmacy insurance card, and we will have our outpatient pharmacy, or if that is prescribed for you, we will be able to let you know what the cost is going to be, and if it's very expensive, we can get in touch with the doctor and figure out a different alternative if that doesn't work for you. Most people will get sent home on aspirin. Usually it's a full dose aspirin, 325 milligrams, or warfarin for up to a week or so. I just want to emphasize if there's any questions about, what anything you might get discharged on, or you have questions about your pre-op, what medications you should take, or if you take an unusual medication, an inhaler or a eye drop, you want to know if you need to bring that in or not, please call the Lakeview Hospital inpatient pharmacy. We're open 24/7, and any pharmacist there can answer any questions. Other than that, just feel free to reach out anytime you need anything. Thank you.
My name is Chris Jackson. I'm a nurse over on the Med-Surg unit, and I'm just going to go over the nursing portion of the joint connection class. This slide shows different components that the doctors might use if you have a knee replacement. And this one shows the different components that the doctor might use if they do a hip replacement. Each doctor has their own preference as far as to what parts they use, but they're all very similar to what you see in the two slides. So before you come in to have your surgery, there's several things that they want you to have done. They want you to have a physical examination done at least 2 weeks prior, or minimum or maximum of 2 weeks prior to your surgery. The doctor would have a form. You can either have them fax it in, or it can be sent to us electronically. Shaving, they would prefer that you do not shave your legs at least the week of surgery, because they don't want any microabrasions left on your skin that can cause any infections. Medications, the doctor will tell you what medications to hold prior to having your surgery. A lot of those are like the blood thinners and whatnot. There's also some blood pressure meds that they might have you hold the morning of surgery. Dental work, they don't want you to have any dental work done 4 weeks prior to your surgery or up to 3 months after your surgery. That includes cleanings or anything like that. If you happen to end up with an abscess or a toothache or something like that, and you do need to go to the dentist, you need to let your surgeon know, so that way they can determine whether or not you're safe to have your surgery done if you end up having dental work done. Nutrition, basically they want you to eat healthy. Make sure that you're well hydrated when you come in for your surgery. Have your fruits and veggies and stuff so that your body is strong enough to recover from your surgery. Deep breathing, it tells you to learn what helps you to relax. Pain after surgery is very common, but if you know how to help your body to relax, it'll help you to recover better after your surgery and help you deal with the pain after surgery. The hospital does have complimentary services that you can use, such as aromatherapy, which is a small patch that we can put on your gown to help with nausea, not being able to sleep, and things like that. There's hand massage, pet therapy, music therapy, and we also have a lovely care channel. It plays very relaxing music and helps you to be able to sleep. Before your surgery, you'll get a phone call from a nurse here at Lakeview Hospital, and they'll want to go over your list of medications. That list seems to come up several times throughout your admission process and when you get here. The most common thing that if people forget about it's an omission, but we can always fix that list when you get here. On that list, they'll want to know the medications you're taking, the dosages, the times you take them, and what you're taking them for, even if it's an off-label reason, such as maybe you say you take Benadryl at night to help you sleep. We can always, put that on there that that's something you help to sleep. If you do forget it, like I said, we can always get those medications added after you get here, and the doctor, we basically just give the doctor a call. What to bring with you? We ask that you bring the joint connection book that you were given. The therapist will be working with you and they will write in there your exercises that you'll be doing. If you have glasses, bring the eyeglass case for those. If you have hearing aids, bring the box for those, and also some replacement batteries if they run out often. If you have a CPAP, bring that with you. And if you have a denture cup that you like to store your dentures in, bring that with you as well. We do have some here that if you do forget it, as far as denture cups that we can use. And then we also have like little eyeglass sleeves if you forget your eyeglass case. We ask that you don't have artificial nails or nail polish on. We use something that's called the pulse oximeter. It's a clip that goes on your finger, and it helps us to monitor your oxygen level and your pulse rate. Clean sheets and clothing. Clean sheets is something that you should have at home for before your surgery, and bring a change of clothing, something comfortable to wear when you're discharged from the hospital. On the phone call that you get, as far as to telling you what time you need to be here for surgery, they'll tell you when to stop eating, and it's usually at midnight the night before your surgery. Make plans for when you're going home. If you have friends that say they want to stop by after surgery, they can be the ones that say, well, if you're going to come visit afterwards, maybe bring a casserole. Sorry, I'm from back east, and I always say casserole, but you could bring a hot dish or something like that, things that you can keep in the freezer. If you feel ill prior to surgery, the night before surgery or the morning of, you wake up and you just don't feel good, you need to call two people. You need to call the hospital to let them know that you're not feeling well, and your surgeon. It'll be up to your surgeon as far as to whether or not they'll proceed with your surgery or not that day. So before your surgery, you'll have to buy a small bottle of Hibiclens. So 2 days prior to your surgery, you will take a shower at night, and you will use a third of that bottle of Hibiclens. You'll put it on a washcloth, and you'll wash yourself from your neck down, avoiding any open areas or your genitalia because that can burn. Then you'll rinse off in the shower and put on some clean jammies and sleep that night. The day before your surgery, again, you'll take a shower as you normally do. You'll use a second third of that bottle, again, putting on a washcloth and washing the areas I mentioned before. Rinse off in the shower, put on clean jammies, and sleep in clean sheets that night. The morning of your surgery, again, you'll take another shower. You use that last third of the bottle of that Hibiclens and wash that area again and rinse off in the shower. That day, you'll get dressed in clean clothing to get ready to come to the hospital. They don't want you using any lotions, powders, deodorant, or makeup, and then you'll just drive yourself here to the hospital. Again, what to bring is that joint connection book that we discussed, your insurance card, photo ID, glasses, hearing aids, dentures, and the cases they go in. You're going to want to wear flat shoes or something comfortable. After surgery, it's very common for people to have a little swelling in their joints, in their feet after getting IV fluid. So comfortable shoes that you know you'll be able to get on. Again, there's that list of current medications that they want you to bring with you. Again, your CPAP or BiPAP, and a living will or a healthcare directive if you have one that you've made out. If not, we do have social work here that can help you with those if that's something you want done while you're here. The day of surgery, you'll come in the main entrance, and you'll come around the corner and up the ramp, and you'll come to the admitting area. At that point, they'll put your ID bracelet on, and they'll send you downstairs. In the surgery area, you'll report down there to a desk, and they'll bring you back. You'll get dressed in a hospital gown, a robe, and an identification band. They'll verify who you are. If you get here early enough, you'll get one of the hospital gowns that has the ermine fur and sequins on it. Your personal belongings will be bagged up, and they'll be stored downstairs in the same-day surgery area. And family and friends will get a phone call from the surgeon when all is done. When you go back into the same-day surgery area, they'll do vital signs and get an IV started, and that's why I suggested being well hydrated before you come in. After your surgery, you'll be taken to the post-anesthesia care unit, which we like to call PACU, and it's at that point that you're done with your surgeon, so he or she would be calling your family to let them know how your surgery went. In the post-anesthesia care unit, that you'll have a one-to-one nurse with you. They'll be monitoring your heart rate, your respiratory rate, your pulses, how you're waking up from your surgery. And you'll be down there anywhere from 45 minutes to an hour, and they will call up to the floor to let us know that you're there so we can plan what room you'll be coming to when you come back to the unit. After that 45 minutes, you'll come up to the medical surgical area. Again, on the medical surgical area, we will continue to be monitoring your vital signs. You'll have a head-to-toe assessment done by your nurse, and your nurse will orient you to your room as far as to your call buttons and things like that and how to get a hold of your nurse and nursing assistant. You'll be started on what we call a clear liquid diet, which means you'll get some sort of a juice, a jello, a clear broth, and so on. We will advance your diet slowly that day, and depending upon what time you come up, you may be on regular food by dinner time. There's that clear liquid diet on there. We will also be starting you on pain medication. If you've had surgery before and you know what pain medications work for you, it's good enough that we'll ask you that so that we don't have to recreate the wheel to find out what's working for you. We'll fit you for some lovely TED stockings. For those of you that have your hip done, you'll have knee-high stockings on, and those of you that have knees done, you'll have thigh-high stockings on. We'll monitor your dressing. Every surgeon has a different way of doing it. We'll look at your dressing. You'll have IV fluids running, and we'll be giving you your medications that you normally take. You may or may not have a drain in your surgical site. Physical therapy will come and work with you. Yes, they will. That day of surgery, they'll get you up and walk you right away after your legs have woken up, depending upon what type of anesthetic you've had. If you have an insurance card for retail pharmacy or to get your prescriptions filled, make sure you have that with you as well, because that might be required for when you have your prescriptions filled prior to discharge. This is what we call the pain assessment scale. It's posted on every board in every room on our medical surgical unit, and it's also in a folder that you'll be receiving when you come to the floor. This just helps us to determine how bad your pain is and how much pain medication that you'll need to take while you're here. We also want to keep you safe while you're here, so we will assess you for whether or not you're a falls risk. And you're at risk of falling when you first get here because A, you've had surgery and you're slightly weak. The medications you take can cause you to fall, or if you've had a history of falls, or you don't want to bother the staff, please bother us. We don't want you falling because there's just too much paperwork to fill out if you fall. How you can prevent falls is ask for help. There's plenty of call buttons either on your bed or on a pendant that we give you. If you wear glasses or hearing aids, we'll make sure you have those with you. We want to make sure you have shoes or slippers on to make sure you don't slip and fall, and we'll instruct you on how to use a walker right after your surgery. What we're going to do to prevent falls is we're going to help you to move. We're going to have a gait belt that we put on you that gives us an extra handle to hold on to you while you're walking. We're going to monitor you for any dizziness and be really close to you when you first get up. We call it within arm's reach when you're first up and walking. If necessary, we may have to set a bed alarm just to make sure that you're not getting up without us. Before going home, we'll discuss with you your incision and what kind of dressing changes need to be done. We'll work on you for discomfort, letting you know what pain medications you're taking. We'll also let you know when your last doses were before you go home. And this awful side effect of the pain medication you're taking is constipation. So we'll also be sending you home on something that'll help you to be able to go.
All right, hello everyone. Welcome to the rehab section of this presentation. Thank you for choosing Lakeview for your total joint. My name is Sandy. I will be your presenter today. I am one of the therapists here at the hospital, so you'll probably see me when you come. So everyone, how long will you stay in the hospital? Keep in mind everyone progresses at a different pace. Please do not compare yourself to yourself if you've had another joint done or to anybody else. All right, everybody progresses at a different pace. Most of you will be in the hospital anywhere from 24 to 48 hours, more likely 36 hours. We will probably see you once or twice a day. The majority of you will go home with outpatient therapy. We will focus on this goal. Some of you will end up with home care physical therapy, which means a therapist will come into the home. And some of you, depending on other issues, may end up at a transitional care unit called a TCU. Going home is probably going to be the most benefit, because the sooner you can get back into doing things for yourself, the better off this knee or this hip will function for you. When will I get up? You will be up the day of surgery. You may not be seen by a physical therapist that day, but you will be up. So if we don't get you up, nursing will get you up. You are not allowed out of bed or out of your chair without contacting one of your healthcare team members, which is going to be nursing, nurse aide, physical therapy, or occupational therapy, but you will be getting up and getting moving. The sooner we can get you up, the better off you're going to feel. A walker will be delivered to your room, so if you have a walker at home, please do not bring it in. For some reason, they get lost here in the hospital. Leave your walkers at home. We will provide you with a walker while you're here in the hospital. You will be up to and walking. We will be working with wheeled walkers and single end canes. If you do not have a wheeled walker at home and you are not going to get one or can't borrow one from somebody, but you do have crutches, we are willing to work with crutches. And if you've been on trekking sticks before, which are walking sticks, we will work with the walking sticks. But if you have never used crutches or never used walking sticks or trekking sticks, please do not use them afterwards. We will set you up with a walker and a cane. I'm going to show you a video of the walker.
When using a walker, maintain good posture, stay within the walker, and walk as normal as possible.
So we will start you out with a walker first, and as soon as you are walking as well as this young lady has shown, we will advance you to a cane. This is how you use a cane.
When using a cane, it will be held on the opposite side of the surgical leg. Cane advances with the surgical leg. Maintain good posture and walk as normal as possible.
You will stay with your cane until you can walk normal without limping. If the limp is gone, then you can get rid of your cane. You will be seen by physical therapy every day, 1 to 2 times a day, depending on how long you stay here in the hospital. You will hopefully be seen the day of surgery, which will be once. You will be seen the next day, once in the morning, once in the afternoon. Unless you decide to go home that day, then you'll probably only be seen in the morning. If you stay another night, you will be seen the following morning by physical therapy, probably just once. And again, therapy progresses at different pace for each patient. It's all going to depend on your pain level and actually your good attitude. Your goals for physical therapy before we send you home safely is you need to be independent and safe with mobility, which means getting in and out of bed by yourself and safely, to and from the bathroom, on and off the toilet. You need to be safe and independent in walking with some kind of an assistive device. I don't care what it is. And you need to have a really good understanding of your home exercise program. You have a good technique and you can follow through well enough with your exercise program at home. Can I do stairs? Yes, you can. You do not have to avoid stair climbing. However, I want you to plan your moves. So if you're used to climbing the steps 6, 7, 8 times a day, we're going to move that down to 1, 2, or 3 times a day. Plan your moves. So if you've forgotten something, I do not want you running up and down those steps again. Whoever's with you is going to have to do that for you. If you have outside steps, 1 to 2 outside steps or more, and you do not have a rail on it, you have the possibility right now to have somebody do that. Let's face it, as we age, and I'm in that group with you, handrails are a good thing to have. So if you have the capability and you have somebody who can do that for you, have them get a railing on those staircases. Here's a demonstration for stair climbing.
Stair climbing singly. We're going to go up with your strong legs first, cane in the surgical leg, step up to the same step. When coming down the steps, the cane and the surgical leg come down first, the good leg to the same step.
This is a good question. Will I have pain after surgery? Yes, you will. You are having your joint reconstructed. Pain is part of that process. Pain is expected, and medications are available to keep you comfortable. Pain control, you'll see those facial expressions. Nurses and PTs will always ask you, where's your pain level on that scale from 0 to 10. And if you have a total knee done or a total hip done, if we can keep you at 5 or less, you're doing very well. If you're above that 5 mark, you really need to have a good conversation with either your doctor or your nurse and come up with another type of medication plan. Icing will also help with pain control. You're going to ice 20 to 30 minutes at a time and as often as you need it. And your knee will let you know or your hip will let you know when you need it. For those of you who are having the total knees done, we are going to consciously make an effort to keep your legs elevated while you're in bed to help control the swelling. Total hips will also have some swelling, but it's not going to be as major as the total knee is. Now, when you go home, you are going to continue with your exercises that we have given you here in the hospital. Each of you will be going for outpatient therapy, or if we deem necessary, you will have a home care therapist come into the home. But for outpatient therapy, those of you who are having total knees done, you are going to start your outpatient therapy right away, ASAP, as soon as you discharge from the hospital. For those of you that are having the total hips done, you're going to be able to wait up to 2 weeks before you start your outpatient therapy. Your exercises need to be mastered before we can progress you on to anything else. Total knees, it's going to be controlling making sure the exercises are going well, making sure you have good quad control, and actually monitoring your swelling. You will be given the home exercise program here in the hospital, and you will need to continue with it at home every day, twice a day. Occupational therapy will be in to see you while you're here in the hospital. They generally will start coming in the day after your surgery, and they generally will only see you once, but they can come back for a second visit if they deem it necessary. And they're going to work on things like getting dressed, especially your lower extremities, underwear, pants, socks, shoes. They're going to show you how to get those on safely. They're going to show you how to get it on and off the toilet safely, in and out of a tub or a shower, and in and out of a car. Do your exercises every day, twice a day, like I said before. If you're going home, again, the sooner you get back into doing the things that you want to do or need to do, you take the focus off your knee and your hip and start treating that body part as if nothing ever happened to it, and it's going to start to feel better. The longer you baby the body part, the knee or the hip, the longer your pain will linger. So you want to try to talk yourself into doing things as normal as you possibly can. Frequent position changes help. Sometimes just getting off the chair or the sofa and standing up and getting some weight shifted into that leg works well. Short walks are great for avoiding and preventing that lying still achiness that you're going to have in that joint. You are not going to be allowed to bathe or swim or submerge that incision in water for up to 4 to 6 weeks. That incision needs to be completely healed, which means tiny scabs that you're going to have to be completely gone. And kneeling is not going to be too much of an issue for those of you that are having the hips replaced. We will show you how to get down and onto a knee or both knees and how to get back up. But for those of you that are having the knees replaced, kneeling is going to be a little bit of a problem for up to 12 to 15 months. Not that you can't get back down again or get on your knees. It's just going to be a little uncomfortable, and you have to have the strength to get back up. Driving is going to be a no until you hear otherwise from your surgeon. Now, the next section is going to be working on your pre-op exercises. We're going to have you do about 3 exercises for each group. The stronger you are going into surgery, of course, the better off you're going to be on the back side of it. So for those of you that are having the total hip, please open your books to page 7. And those of you that are having the total knee, please open your books to page 8. Total knees are going to be doing quad sets, straight leg raises, and seated knee extension flexion. Total hips are going to be doing quad sets, gluteal sets, and bridging. And we're going to go through each of the exercises here. So this first one's a quad set. I need everybody to focus on the kneecap.
Quad sets. The ability to lock your kneecap in place. To do this, you are going to gently push the back of your knee down towards the bed. You can see the muscle contract and the kneecap lock into place. Slowly relax.
All right, those are the quad sets. Both total knees and total hips will be doing this exercise. Straight leg raises are for the total knees.
Straight leg raise. Bend your other knee to save wear and tear in your low back. Do a quad set. Slowly lift your legs straight up in the air, back down, lightly touch, right back up. 10 repetitions, relax. Do not go higher than your other knee.
And the last one for the total knees is the knee extension flexion.
Knee extension, flexion. all the way back in a comfortable chair. You're going to slowly extend your knee, then flex your knee. You're working the quads and the hamstrings. 10 repetitions. Relax.
All right. The total hip patients are going to be doing quad sets, which you already have seen. And then this will be gluteal sets. I need you to watch her buttocks.
Gluteal sets. Just pinching the buttocks together. As you do this, you will get the sensation that you are raising up and lowering back down.
And then the last exercise for those of you that are having the hips is a bridge.
Bridging. Lie flat on the bed with your knees bent as shown. Slowly lift your buttocks up off the bed. Slowly lower back down and repeat. 10 repetitions.
Now those of you, for the quad sets and the gluteal sets, those particular exercises are called isometrics. You will get strengthening and you will get toning with an isometric, but you have to hold that contraction for 5 seconds or longer. Not a count to 5, because most people count fast. Look at the clock, look at a second hand, 5 seconds. Thank you for participating.